My name's Morgan Cups. I'm going to start by doing the 360 of the room. Here is my nursing ID badge, and then this is Morgan Pelsnell, who's also a nursing student, and she is my roommate, so we don't have to use masks, but I need her to consent for the video. Do you consent for this video?
I do consent to the video.
Okay, so now I'm going to go into the assessment. So for opening, before I entered the room, I would have already washed my hands and put my gloves on. I would introduce myself. So my name's Morgan. I'm the nursing student going to be doing your assessment today. And I'd ask her for 2 patient identifiers, such as her name and her birthday, and I would provide privacy to ensure that she felt comfortable. After doing that, I'm going to ask her about her medical history. So do you have a history of asthma?
No.
And do you have a history of wearing glasses?
No.
Okay, after doing the medical history, I'm going to go in and assess her mental status. So she appears to be alert and conscious sitting up, but to ensure that she is alert, I'm going to ask her 4 questions. What's your name?
Morgan.
Where are we?
Our house.
What time is it?
11.
And what are we doing?
An assessment.
So she answered all the questions correctly, which shows that she is alert. I'm also going to ask her about her mood. So how are you feeling today?
Good.
So her mood is appropriate for the scenario, and she also appears to be well dressed for the weather and is well groomed. Also, her speech is not slurred and it is concise. After doing the mental assessment, I'm going to go in and start assessing her facial features. So looking at her face, you can see that it is symmetrical. Her eyes are symmetrical to her ears and her nose is midline. The color of the skin is beige, and it does not appear that there are any lesions anywhere on her face. So after looking at her face, I'm going to assess her hair. So her hair appears to be clean, and there does not appear to be any bald spots or anything within her hair. And after assessing her hair, I'm going to move in and assess her eyes. So I'm going to have her, can you go like this for me so I can look in your eyes? So looking at her eyes, the sclera is white with minimal redness, and the conjunctiva does not have any discharge to it. After looking at that, I'm going to take my pen light. I'm going to ask you to follow my pen, and I'm just going to look at the symmetry of your eyes and make sure that you're following movement. So her eyes moved appropriately and they followed symmetrical. And they're both moving with each other, which shows that nothing is going on with that. And then after that, I'm going to move into Perla. So starting, I'm going to look at her pupil size. So her pupils are around 6 millimeters on both sides. So they are equal and round. Now I'm going to see how she reacts to light. So I'm going to do direct light first. I'm going to shine this light in your eyes, and I'm just going to see how your pupils constrict. So the pupils constricted appropriately once the light was shined into them, and now I'm going to see how they react from indirect light. The pupils reacted appropriately for indirect light, and now I'm going to check for accommodation. So I'm going to start with my pen over here, and your eyes may cross as I move closer to you, but just follow the tip of my pen. Her eyes reacted appropriately for accommodation, and so now I'm going to move in and assess her mouth, but before I do that, I'm going to look at her outer lips. So her lips appear to be pink, and there are no lesions or anything on the outsides of her lips. So I'm going to have you open your mouth for me, and normally I would be using a tongue depressor, but we did not have one. So I'm going to start by looking at her teeth. So her teeth appear to be white and there's no odor. It does not look like there's any dental work done. Now I'm going to assess her tongue, which is pink and moist. Can I have you lift your tongue up for me? And the underside is also pink and moist. Looking at the back of her throat, there is no exudate, and it is also pink and moist with no lesions. And she has had her tonsils removed, so I cannot do a grade on those. After looking at your mouth, I'm going to palpate your neck. Is it okay if I touch you?
Yes.
So I'm going down the middle, ensuring that her trachea is midline, and I'm also feeling to make sure that there are no masses on the sides of her neck either, which there are not, so that is good. Now I'm going to do a general observation of her breathing. So she is sitting up correctly, and it does not appear that she is using any oxygen devices, so she does not need help with that. and she's not using any accessory muscles such as her trapezius or her intercostals. Next, I'm going to move into doing assessing her back or her posterior thorax. So I'm going to ask you to turn around for me. Is it okay if I touch you?
Yes.
I'm just going to feel down your spine to make sure that it is in line. Her spine is in line and it does not have any curvatures through it. Next, I'm going to assess your chest expansion. So I'm going to put my hands on your lower back and I'm going to have you take 3 big breaths for me. The chest expanded correctly and it was equal on both sides. Now I'm going to take a listen to your back just to hear your breathing. So I'm going to do 10 different sections and I'm going to have you take a deep breath each time that I move my stethoscope. Deep breath. 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 After listening to her lungs, her sound was clear and there was no crackling or wheezing and the breath sounds were loud, which is good. Now I'm going to have you turn back and face towards me. And now I'm going to be assessing her breathing again, this time on the front side. So I'm going to be putting my stethoscope back on you and I'm going to have you take deep breaths for me as I move my stethoscope. And I'm starting right below her clavicle. Deep breath. 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 After listening to her lungs again, all sounds were clear and there was no wheezing or crackling and the sounds were loud. Next, I'm going to be assessing your abdomen. So can I have you lay down on your back for me? And I'm going to have you lift up your shirt for me. Let me just move this out of the way. Normally, if you were in a hospital setting, I would have a drape on the bottom side of her and make sure that her top was covered, but she does have pants on, so I don't need to do that today. I can clearly see all 4 quadrants of the abdomen. So now I'm going to go in and start my assessment on the abdomen. So I can see that it is symmetrical and there are no lesions. The abdomen does not appear to be distended and there is minimal pulsations just near the top up here because she is thinner. And there are a few birthmarks around the sides. Next, I'm going to look at her umbilicus. So her belly button is inverted and it does not appear to have any discharge. She does have a belly button piercing, but that is not giving her any issues today. So are you feeling any pain in your abdomen today, Morgan?
No.
So she's not feeling any pain, but if she were feeling pain, I would end in that quadrant. So I'd start in the one right before it. So now I'm going to take a listen to your abdomen. Starting in the lower right quadrant. After listening to her abdomen, there was about 8 to 10 bowel sounds, which is within the normal range, so that is also good. Next, I'm going to palpate your abdomen, so I'm going to do twice in each quadrant. Any tenderness?
No.
Tenderness? Tenderness? Tenderness?
No.
So there was no tenderness while I was palpating. There was no distension. Her abdomen is soft, and she did not grimace or show any signs of pain while I was doing the assessment. Now I'm going to have you put your shirt down for me, and I'm going to have you sit up. Next, I'm going to be assessing your kidneys. So I'm just going to put my hand on your back, and I'm just going to test the percussion of them. Any pain?
No.
Any pain?
No.
All right, so that is the conclusion of the assessment. So before leaving the room, I would make sure that the bed is in the lowest position, the patient is comfortable, both bed rails are up on each side. She has everything she needs, such as the call light or any other personal items. And I would leave the room and then document all of my findings.